9 13-hour shifts back to back. No, I'm not misspeaking here. That is the schedule that Dr. Naeem Ahmed was working when he was found deceased in the on-call room at the hospital where he was working. And the reason that he built that brutal schedule was so he could fly home to Pakistan to help care for his aging parents. So y'all, this is another story of a overworked and overstressed healthcare provider. So Dr. Ahmed, he was 50 years old. He was found slumped over in a chair in the on-call room after working 9 consecutive 13-hour shifts out of 11 that he had scheduled. So in today's video, we're talking about how exhaustion affects healthcare workers physically, mentally, and emotionally. Now, I have to say that it wasn't just exhaustion that caused his demise. So according to the coroner's report, the blood test results did show that there was a small amount of fentanyl in his body, and he did have alcohol in his system. And according to, now this happened over in the UK, so according to reports, he had half of what was allowed for legal drinking and driving. So whatever it is over there, I know it's 0.008 here in the States, but I'm not sure what it is over there. But he had half of that in his system. So 2 syringes and a half-empty bottle of whiskey were found nearby. So over in the UK, I believe they call investigations inquest. If I'm not mistaken, you can correct me down in the comments if I'm wrong. But apparently they heard that Dr. Ahmed's decision-making, according to his colleagues, was flawless that night. He normally did not make mistakes at all, but especially that night, they could not remember one thing that stood out as a concern to him as far as his performance and his decision making. So according to his wife, Dr. Ahmed was fit and healthy, and he really enjoyed mountain climbing, and he went to the gym regularly. Now, regarding his work schedule, he was a contracted employee, I guess you could say. So he was allowed to build his own schedule, and what he would do is he would stack his shifts, and that would allow him enough time off to actually fly back to Pakistan, where he is originally from, and help care for his aging parents. And his wife also said that at one point he even asked her, why can't I just say no? It's not like we need the money. So he wasn't doing it for a financial reason. He was doing it that way because he felt like he needed to take care of not only his family at home over there in the UK, but also fly back to Pakistan and help take care of that family. So his wife also stated that his work pattern was definitely starting to get to him, especially over the last 2 to 3 months before his death, describing his work as challenging, mainly night shifts, long weekends, and what they call trauma list. I guess he was part of a surgical rotation where they have trauma patients that come in that need surgery, but the injuries that they have are not life-threatening. I'll get it out in a second, y'all. And so they're put on a schedule based on the severity or the greatest need of the surgery, I guess. So he had his normal rotations and things that he would do in the hospital, and then he was also a part of this trauma team. Now, let's talk about the fact that fentanyl and alcohol was found in his system. So his wife did say that he would drink outside of work to calm his mind, and that he wouldn't drink if he knew that he was going to be working the next day. She did not call him an alcoholic, and she did not say that he was drinking too much, but probably like you and I do, you know, when we're not working, we like to relax, and sometimes in stressful situations, we might have a drink or two just to help, you know, relax and calm our mind down a little bit, and it sounds like that's what he was doing. So his wife said that he was overbooking himself for the previous 2 or 3 months and that he was absolutely exhausted physically and mentally. So let's talk about what exhaustion can actually do to a person. So exhaustion and sleep deprivation can affect a person's ability to think clearly. It can affect your emotions and the way that you manage those emotions. And it can also cause people to do things that they normally wouldn't do. It all eventually becomes too much and you just hit your breaking point. We were not designed to work at this kind of a level. He never flagged himself as someone in a mental crisis. He just kept going. That's often how burnout kills. It's not a dramatic breaking point, but a quiet erosion nobody intervenes on until it's too late. So I have a note here from an article that I read, and I'm going to read it just to make sure I don't leave anything out and I get it correct. So the coroner issued a formal Prevent Future Deaths report to the Health Secretary and NHS England, raising national concerns about doctors' working practices and long-hour scheduling. This wasn't just one unlucky doctor. A coroner is on record saying that the system needs to change. And it's the same here in the U.S. as well. Now, I think that we are of a generation or multiple generations to where we're not going to overwork ourselves on purpose. But if it is asked of us and required of us for our positions, and I hope I'm saying this right, we tend to not say anything. We just do what's being asked of us, regardless of how we're feeling, regardless if we're exhausted, we're sleep deprived, we know we probably shouldn't be performing our duties at that point in time, but we just keep going. And a lot of the times here in the U.S., especially with nurses, it's because we are threatened with our jobs. So we neglect ourselves first and foremost. We neglect our families and our mental health. And that is not good for anybody. So it not only happens over in the UK, you know, with people that can make their own schedules like that, but here in the US it happens as well, and not necessarily because we're doing it to ourselves. Healthcare workers are praised for sacrifice, but that sacrifice comes at a price and it has a ceiling. The healthcare system in general just pushes the healthcare workers to their limit for profit. So I think Dr. Ahmed maybe just didn't want to disappoint people and felt that he just had to keep going, and he built his work schedule the way that he did so that he wouldn't disappoint anyone. And he didn't want to disappoint his parents and felt the need to take care of them. He also had a wife and 3 children that he was trying to take care of. And doing all of that while exhausted and burned out. I do know that his wife said that he very rarely lost a patient, but when he did, it really affected him. So you've got that mental aspect of it going on as well, with the exhaustion and the sleep deprivation. So I think he just didn't want to disappoint anyone. No one really knows why he had the bottle of alcohol, and no one knows where he got the fentanyl. So according to the hospital, in some of the articles that I read, and I will link them in the video description so that you can check out those articles yourself. But according to the hospital, they have a very strict narcotic system over there in the UK. And from what I understand, it takes more than one person to take a drug out of lockup, or however it is that they do it over there. So the hospital is unsure how he got the fentanyl. His wife was not aware that he was using fentanyl, and he typically did not drink at work. So this whole thing this is why I was saying earlier in the video that the exhaustion and the sleep deprivation makes you do things that you normally wouldn't do because it affects you emotionally and mentally. So anyway, guys, I hope you enjoyed this video. If you did, please do me a favor and give this video a thumbs up and subscribe to the channel so that I can keep this channel going and bring you more stories like this. And I will see you guys on the next one. Bye, y'all.